Hi everyone, welcome to Mindbraintalks. Today, we are diving into the compassion-focused therapy, or CFT for short, a form of psychotherapy that can be included in the so-called third wave of cognitive behavioral therapies. So, what is CFT? Compassion-focused therapy is a clinical approach that blends cognitive behavioral techniques with evolutionary psychology. Paul Gilbert, a well-known British psychologist, developed this approach, and his research suggests that our brains are wired for both self-criticism and self-kindness. Also, other studies suggest that being kind to ourselves can help us bounce back from tough times. CFT is especially appropriate for people who have high levels of shame and self-criticism, and who have difficulty in feeling warm and being kind to themselves or others. So now let's break down some core aspects of CFT. CFT is aligned with evolutionary theory, where three types of functional emotion regulation systems are extremely important to this theory. These systems are the drive system, the safety system, and the threat system, which tend to be related to mental health. So now let's break down these three systems. Threat and self-protection focused system evolved to alert and direct our attention to detect and respond to our threats. So it's a system related to protect ourselves and our group. The drive-seeking and acquisition system, it's a system that helps us to pay attention and notice advantages, resources, and experience drive and pleasure in securing these resources. Finally, the contentment, soothing, and affiliative system, which enables the state of peacefulness when individuals are no longer focused on threats or seeking out resources. So, these three systems are core instances in our personality according to CFT. One of the most important therapeutic interventions in CFT is the compassionate mind training, which teaches the skills and attributes of compassion. Compassionate mind training helps individuals transform problematic patterns of cognition and emotion related to anxiety, anger, shame, and self-criticism. According to CFT, there are several therapeutic techniques that help patients relate to their difficulties in compassionate ways and help us provide them with effective tools to work with challenging contexts. Let's see these ones, okay? The first therapeutic aspect is to develop a positive therapeutic relationship. The second is to develop a non-blaming, compassionate understanding of the emotional suffering of the patient. Third is to develop the ability to experience and cultivate compassionate attributes. And fourth, to develop compassion towards the self and others. This practice can really boost our mental health and well-being. Let's try a simple exercise. The self-compassion break. When you're stressed or feeling down, try to do this. First, acknowledge your pain. Say to yourself, this is tough. Next, remember that everyone goes through hard times. Tell yourself, I'm not alone in this. And finally, be kind to yourself. Put your hand on your heart and say, may I be kind to myself. Doing this regularly can change how you deal with stress and failure. Bringing CFT principles into your life isn't just about feeling better. It's about challenging how you relate to yourself. Also, as future therapists, mastering these techniques will not only help you, but also help your clients. Well, it's all for today. If you like what I'm doing, please consider to subscribe to support the channel. Welcome to Mind Brain Talks, and I hope to see you in the next video. Bye!